you go into this sort of more intensive, aggressive reset mode where you're prepping actively for this shift, right? You avoid the sugar, you don't over exercise, you maybe do a little bit more mindfulness and stress management, exercise, et cetera. And the feedback that we got from that was super interesting because they just said that was really, really helpful.
Hey everyone, today I speak with Dr. Sunjya Schweig with the California Center for Functional Medicine. Great conversation. They have this really interesting first responders program where they've learned a lot about how to mitigate the negative effects of shift work on sleep and also dealing with traumatic events and PTSD. Both of these have applicability to a broad lay audience, so there's some nice pearls there. And then we get a little bit more into mindset. We have a couple stories on psychedelics, a few tools that are helpful for breath work, and I share a personal story there that I think you'll hopefully find insightful. And then we do a quick wrap with a couple tools in the gut health arsenal. So just a great sort of potpourri of topics with a very astute functional medicine clinician, again, Dr. Sunjya Schweig from the California Center for Functional Medicine. And here we go to the show. Hey, Sunjya, welcome back to the show.
Yeah, thank you. Thanks so much for having me. It's great to be here.
It's always nice to chat with you. I'm thinking back when we first met. And gosh, I feel like I'm kind of dating myself and you also. It could have easily been 10 years ago at a Lyme seminar.
Yes.
We kind of stayed in touch and now you're at the California Center for Functional Medicine doing some great work. So it's been fun to follow your career and stay in touch over the years, even though it's many years it's been.
Yeah, I remember that time we met actually that day. I was down in South San Francisco, down by the airport in the hotel. And yeah, that was a very interesting conference. And I just appreciated, we were both earlier on in our careers, and I just really appreciated your excitement and enthusiasm and love what you've taken and done with it all. So it's really impressive to watch.
Same here. And if people missed that episode, because when you came, so you have also come on the podcast, and this was maybe 5 years ago where we went into Lyme. But in case people hadn't heard that one or haven't heard of you, can you give us a quick sort of background, who you are, what you're up to, what you're interested in?
Absolutely. Yeah. So I've dedicated my career to integrative and functional medicine since before I went to med school. Even I was very interested in a lot of this work when I was, high school, even undergraduate at UC Berkeley, and worked my way up through the years. I decided to go the traditional educational route, got my MD at UC Irvine, and then went to the UCSF Santa Rosa Family Practice Residency Program. And basically, I love science, I loved medicine, but however, anytime there was an elective or an opportunity to kind of, carve out some education within integrative medicine or functional medicine, I would do that with other specialists and write my papers and do my research on any topic of trying to bring myself back to the integrative and functional medicine side. And then right when I finished my residency in 2007. I joined a private practice functional medicine, and I basically worked my way up through there. And 2014, I founded the California Center for Functional Medicine with Chris Kresser, and that was an amazing time. And we are still very good friends. We did part ways a few years ago when he moved out to Park City and refocused on some of his other businesses. And at that time, I took the opportunity to really reimagine what we're doing at CCFM and really kind of double down on what we see needs to happen for patients with complex chronic illnesses and chronic illness in general, which is this really in-depth functional medicine approach. And we also marry that with a really robust care team. So we're looking to integrate people's care with clinicians, with health coaches, with nutritionists, our admin care team. And we really kind of walk people through an experience of, that yes, you need the right tests and yes, you need the right treatments, but we need to understand the science of health behavior change and what it takes to be successful with implementing all the things that you ask, that we ask. It's a lot of work to be a functional medicine patient if you have a chronic illness and you're trying to recover. And so we try to offer that hand holding. And so we think of that as the high touch side. And then we also are really interested, one of my passions is data and wearables and visualizing data creating data dashboards, and so we can understand, what does that physiological shift look like over time. And we're really at this amazing time in medicine, and we're going to be talking today about some of the work that we've done with first responders, with firefighters in particular, and police. And again, that same concept of this high touch care team with this high tech data side, so that we can really, I think, kind of blow up what's happening with chronic illness prevention and management.
Right. No, I love the approach. And I'm assuming that we agree on pretty much everything. One thing I do want to pin to the board that we can come back to,
yeah,
and not to be overly particular on semantics, but it being a lot of work to be a functional medicine patient. I think we're on the same page where hopefully as the field is maturing, we're being a bit more choosy with our recommendations. And again, I don't mean to be overly particular about that, but I'm sure you probably see some of the horror stories that I see where people are on such a arduous diet. They're eating 7 foods and they're afraid of everything because they've kind of created this conglomeration of different recommendations they've thrown together from different gurus, and they don't really have the right guidance. So they're kind of hyper adherent. So I just want to take that as an opportunity to find that balance, maybe for the person listening to this who is hyper adherent, that with the right guidance, I mean, sure, you do have to make some changes. Absolutely. You have to do some work, but it shouldn't feel like you're walking up hill both ways in the snow, kind of, like your grandparents' story about how they went to school. It was really hard. It was uphill both ways in the snow. It was super treacherous. But maybe just to pause there for a second, what's your perspective there?
Yeah, I think that's such an important point. And I think there's a bell curve, basically, right? There's like sort of, a distribution of patients that we see and that you see. And there's some who are mildly to moderately impacted by their health issues, and maybe they want to optimize their health. There's a big group in the middle that have more significant impairments, but they still have some flexibility and some choice. And then there's this sort of tail end, more severe group who really do get into a lot of stuckness and a lot of fear, in particular, because they really can't figure out what their body's going to do on a given day and what's going to impact them, what the reaction to a food is going to be, or to an external exposure, whether it's stress or air or water or EMFs, the list goes on. So that, I think that's particularly what you're talking about, that sort of end of the bell curve group. So we do really, really try to get people back to their normal lives as quickly as possible. And, and sometimes that takes a little bit of a dance, right? And so, but if you have knowledge and awareness of all of the levers that can be pulled, for example, when someone is hyperreactive to foods, we're going to work on the gut, obviously. We're going to work on, stool, parasites, SIBO, intestinal permeability, short chain fatty acids, inflammation, all those factors, probiotics, prebiotics. But we're also going to work on, are there any hidden infections? Is there any Lyme disease? Is there any Bartonella affecting the gut? What's their sleep like? What is their exposure to water and other epigenetic forces that are going to change their body? What is their brain like? What are what's the, work that we could do around neuroplasticity, around calming down that fight, flight, freeze, amygdala state that's also triggering that reaction? What does it look like from a mast cell point of view? Are they exposed to mold? Are there heavy metal? So all these different things that can trigger that hyperreactivity. And in my experience, in these cases, it's not easy. But if you know the levers to pull and you kind of figure out the right order and the right timing and listen to their body, we're always, always, always trying to get them back to a more open, more relaxed, more flexible, metabolic, physiological state. And that, of course, includes, what they can and can't eat. But yeah, you're right. Diet and what people are putting in their mouths is both healing, but it can also become a source of fear and frustration for folks. And that's really difficult.
Yeah. And I like the bell curve analogy. We could paint that as some people might be doing very little for their health. So they have to put an effort to be a bit more attentive. And then on the other end, people might be hyper attentive and they need to have some focus on, as you said, the right couple levers, perhaps, and then let a few of the other levers go. I like that analogy.
Yeah.
So let's maybe give an overview, because there's 2 things I'd like for us to explore. The California Center for Functional Medicine. I think that's going to be center stage with a lot of our conversation and what you guys do, how you can help people. But I believe this goes back to the Rob Wolf, Chris Kresser duo days. I could be wrong on the inception of this, but public or first responders, there's so many things there that I think are opportunities to go wrong, especially thinking about sleep. And when I was looking through sort of the brief of the program, I was really happy to see that gut health was one of the chief focuses. As I was thinking about this conversation this morning, the sleep has got to be a tough one to try to get around. And I guess to some extent you can, but maybe you can buffer it. Maybe to kind of zoom out high level, what's the first responder program and what are you guys doing with that cohort?
Yeah, so this program started in 2016, and we were approached by a gentleman out of the Berkeley Fire Department who had his own experience with paleo template diet, with CrossFit, with general wellness. His name is Amori Langmo, and he's a great guy. He's become a good friend of mine, and he was, with his own personal experience, in his own body and his own health, and then looking at the risks that are facing firefighters and first responders in general, kind of had this head scratching moment. Said, wait a minute, this is not right. We need to do better. And so he reached out to us and said, hey, found you guys. I'm personally passionate about functional medicine. What can you guys do to help us? And, we basically just were super psyched. We jumped at the chance and worked with him over that summer and built and deployed this original version of the wellness program. Originally, it was basically being provided to new recruits, so the Recruit Academy as part of the Berkeley Fire Department. And so we had their attention for about 4 months when they were going through Recruit Academy. And we basically put them through, what you and I would, a good functional medicine doctor would think of as sort of the basic sequence of lifestyle steps. And, backing up for a sec, it's important to understand that the top two killers of firefighters are cancer and suicide, right? So, completely unacceptable in my opinion. And
Right.
What's interesting, however, is that they're starting to get a little bit more understanding of this reality and the fact that there are things that they can do about it, right? So there is a change in the tide of some of the work that the first responders are doing, but it is slow. So we basically got together with them and built a 4-month program. It later morphed into a 6-month program, but we basically go through all the foundations of functional medicine, right? And so we start with nutrition and gut healing. We put them on, we educate them, we do a whole pantry clean out, we do a 30-day Whole30 reset, and we track data, right? So we're measuring lab studies at the baseline. We do body composition with DEXAs and or body fat dunk tanks. And then we put wearables on them, like the Aura Ring, for example, and we track their physiology, their heart rate variability, and feed that data back to them and say, hey, look at these outcomes that are happening as a result of these interventions. When we did work with our cohorts, it's pretty incredible. Just that first month of that nutritional reset, we saw a more than doubling as a cohort level, 18 people. We saw more than doubling of the heart rate variability, HRV, right? Just resetting their diet and getting them moving a little bit more. Really impressive physiological changes, lowering of heart rate, lowering of resting heart rate, increase of heart rate variability, et cetera.
Right.
So first month is nutrition, and then we go into recognition and command of stress. We go into sleep and circadian rhythm for a month. We do a month on metabolic health. There's a huge incidence of overweight, obesity, metabolic syndrome, diabetes, et cetera, with first responders. And then we go for the firefighters into cancer and detox. So it's basically this, month by month sequence with a lot of hand holding, a lot of data. We ask a lot of them. That was one thing that was challenging was, these very, very busy people, but really amazing outcomes on the back end. And so, just as a sort of a reset and a touch point and a chance to kind of redirect their careers and some of the risks that are facing them, it was just a really powerful experience all the way around.
I mean, so many threads there to pick up on. Maybe I'll lily pad over the gut because I think you're preaching to the gut choir here. We're all saying like, hallelujah, right? Importance of gut health. The stress one I think is interesting. Knowing that some of these guys and gals have probably seen some pretty traumatic stuff, and how impactful and pernicious that can be. And there's all these great tools. Even now, in California, I think there's this decriminalization of psilocybin, also ketamine. So these are some interesting things that are coming into popularity of late. Are there certain tools that you're finding to be particularly effective? And maybe does that parse down to general stress management as compared to a different tool for overt PTSD?
Yeah, so the mindset piece and the recognition and command of stress, as we called it for these programs, was just so incredibly critical. First responders are out there on the front line facing some incredibly difficult and traumatic events. And there's sort of, what we call little T trauma that they're experiencing from the day-to-day, little things that just kind of bug them or rub them the wrong way, or like, incidents that are smaller, but still irritating to their nervous system. And then there's big T trauma, right? Mass casualty events, natural disasters. A lot of the first responders that we talked to said that some of the most difficult things to deal with emotionally were, showing up on a scene for when there was somebody dead on arrival, or trying to resuscitate a child, for example, or showing up for, severe child abuse, situations. And so they're experiencing really just horrific events on a routine basis. And one of the things that we got really curious about and really aware of was that the culture, and it's changing, and I think it's different, for example, here in California, where we've worked with groups up in, Bellingham, Washington, or in Santa Clara and Berkeley, et cetera, versus across the US. The culture, for a lot of these folks is pretty type A, pretty macho, pretty, I'm strong, and therefore I don't need to talk about it. And they basically just kind of laugh about it and joke about it, and go about their business and go back to having their dinner when they get back to the station, et cetera. And so that's starting to shift a little bit, but a little bit too slowly, in my opinion. And, we want to change that to, I'm strong, and therefore I can talk about this, and I can ask for help, and I can get the assistance, and we can process this as a group. And there is some good work. There's a lot of peer support, and there's a lot of, debriefs that happen. There's what's called a critical incident stress debrief that happens after a large scale incident. But unfortunately, all too often that is really just hey, let's get you guys in a room, guys and gals, let's, give you some information on what to look for, what the, signs and symptoms of PTSD are. And here's a flyer, and give us a call if you have any trouble. Right. And so,
so that's one thing I wanted to pick up on is I'm assuming that some people may not have the awareness to know what the signs and symptoms look like. So it's a little bit insidious. Especially for the kind of person who's just like, hey, gotta keep going. The hero runs into the fire sort of thing. Is that something that's fairly prevalent in this group?
Absolutely. Oh yeah. These are like super hyper competitive, hyper achieving, like just incredible people. And we think of them as industrial athletes. They're, usually very fit and strong, and just very much go-getters. What's interesting also is like, we haven't been able to dig up a lot of studies on this, but I do think, I'm sure of ACE scores, right? Adverse childhood events, right? And so it's that phenotype of this sort of like caregiver above all else, like caring for other people before they care for themselves. And there actually is this kind of some wisps and some hints in the field around that these people might actually have a baseline higher ACE score in some cases. And so that also kind of predisposes them to traumatic activation, but then also,
are they more, just not to derail you, but do you notice more constipation in this group? Because I know adverse childhood events correlates with constipative type IBS or just idiopathic constipation. Do you see any trend there?
That is so interesting. Not off the top of my head, but I should go back and we kind of we have everybody fill out, MSQs and various questionnaires. That'd be a really interesting question to try to
plant
pull
that
out.
seed. Yeah.
That's super interesting though. Yeah. Because hydration, actually, that's another thing. Hydration is an issue too, right? People are working hard or sweating or in their turnout gear and losing a lot of fluids. And so that was one key piece. So it also can obviously predispose to constipation.
Yeah. What were some of the, just for our audience also, what are some of the hallmark symptoms to be on the lookout that you may be experiencing PTSD? Because because I think this may have relevance to the health conversation for kind of that one cohort where I think they may have a degree of, if we could call it, functional medicine idiopathic PTSD. They've had so many labs. There's been so much sort of fear mongering combined with not feeling well. And so I'm trying to do a better job of voicing this on the podcast so that people can determine this, because as I'm sure you've seen, for some people, you've got to do something for the limbic system. It's, the solution isn't doubling down on diet or supplements. You need some of that. Like you said, the appropriate levers, sure. But one of those key levers seems to be this neurological piece. And so if there's some hallmark symptoms to flag that for people, I think that'd be really helpful.
Yeah. So we see a lot of cognitive symptoms. So people having a little bit more difficulty thinking clearly, difficulty processing, difficulty making decisions, starting to get intrusive thoughts, like sort of flashes or memories of traumatic events that become increasingly difficult to, and a lot of people just basically try to stuff that away. Like, oh, I'm going to think about something else. I'm going to do something else. I'm going to go exercise. I'm going to a lot of times people medicate, right? They'll drink or they'll take drugs. They'll try to, numb out from it, or they'll shop, or, like a lot of coping behaviors. So those are key areas, intrusive thoughts, also, disruptions in sleep, starting to lose, having nightmares or more vivid dreams, again, more fatigue. And then also just like sort of a general feeling of detachment, numbness, like not feeling connected to your friends and family, not caring anymore, having trouble, manifesting that sort of aliveness that, then lets you feel connected and like you want to help. A lot of first responders told us that because of what they experience at work and because of what they have to sort of keep contained and separate from their home lives, is that they then go home and they have trouble, being with their kids and with their spouses and with their other family members and friends. And they feel like, everyone's having a great time and they're kind of faking it, right? And they're feeling this sense of like almost like depersonalization or derealization, where there's like a film or a shield that's separating them from their lives. And that can become really, really disheartening and really, spiral. And then of course, anxiety, low grade to moderate to severe depression, and even
that's what's interesting about depression. I was just going to make that quick tie-in is that, and this is something I recently learned when I was just kind of double checking the basic definition of depression, which is a withdrawal from activities that you used to enjoy or less enjoyment from those activities. So this is where maybe playing with your kids used to be really fun, and now it just feels like a chore.
Yeah. A chore, or it doesn't feed you, or you're not able to pay attention. You're not able to like really engage with them, and and they're your kids or your spouse was kind of, a lot of them were reflected. They might be asked like, "Hey, what's going on? Where are you? Like you don't seem to be present. Are you okay? And so then that can compound, right? Because you sort of get in your head more, and so it can be extremely difficult.
Sure. And regarding tools, are there a few that you found to be particularly effective, maybe a few that you've even found to be ineffective?
Yeah. So the biggest ones I think are, the general lifestyle reset, right? So, if you get somebody eating the right foods and hydrating and moving, in adequate and responsible ways, those are really, really key. Getting the right amount of sleep is incredibly important, right? So that was a huge lever. But then the things that we really found were amazing was breath work, And breath work is kind of really cool in my opinion because it does so much, right? So there's so much that you can do. There's different techniques, different patterns, in breath hold, out breath hold, various cycling, etc. But it's kind of like an easy in for some of these folks because some of them are super open to mindfulness and meditation. There's a lot more awareness around that now, especially here on the West Coast. I imagine it's the same where you are in Austin.
They may not be active enough. Some people who are really type A, it's hard to get them to sit. So it's like, well, all right, just do this breath work, and you're doing something rather than meditation. Often feels like you're not doing something. And for those sort of hard driving type A's, I happen to know one of those. It can be hard to do that.
And it can also feel kind of woo woo, right? Like I'm not a Swami. I'm not going to sit here in cross-legged pose. Like I'm a firefighter. Like leave me alone. So the breath work is really active. You can count this, and what we got really into also was basically showing them the data, right? And so really, really simple. And we do this with groups too, when we lead groups now. But basically, we'd have them do a 10-minute exercise as a group, a mindfulness or a breath work exercise. We'd have them measure their pulse prior and after, and we'd have them measure, just rate their perceived stress on a scale of 1 to 10 before and after. And 10-minute exercise, and basically we were able to show over basically like a 28% decrease in perceived stress for the cohort with these exercises, and usually like an 8 to 10 beats per minute drop of resting heart rate. And so that speaks, right? They see that data, and they're very data oriented people, and so that really kind of wakes them up because whoa, like there's something to this. There's something that's real here. And so, so that I think that was quite exciting for us to see.
Yeah. I mean, it's a big drop in your pulse rate. Is there an app in particular that you're using, or how are you kind of plugging people into this?
We've used various. We use the HeartMath biofeedback system for several cohorts. There's a really wonderful mindfulness and meditation app that just sort of is very crisp and very modern feeling. It's called Buddhify, and it has Yeah,
Okay.
Buddhify, really beautiful interface, and really cool because it's like basically built for meditation on the go, like meditation within our busy lives, and has a
Mhm.
bunch of a variety of different, types of different meditations and durations also. Like some are just a few minutes long, some are 7 minutes, some are 10 minutes, etc. So that was really helpful. We also collaborated with a friend of mine, Josh Dunce, over at Stasis Breathwork, and so we had him come in and do some guest lectures and teach on breathwork. We've since, developed a online course on our website that's offered to the public, and so we would then
Okay.
offer them access to that, which basically walks them through several of the really key breathwork interventions like
Mm.
4062 is a great one. The 478 breath is amazing for stimulating the vagus nerve and calming down the nervous system. And so, box breath box breath is quite well known actually in the military
Right.
and the first responder community. So they really are, very accepting of that. So all these were really helpful. Another thing I should mention, that we find really helpful in general for our patients. This is sort of like a favorite technique of mine. I did it this morning. When you wake up, go outside, get some morning light exposure on your eyeballs,
Yes.
and
Yes.
walk around 10 or 15 minutes and do some deep breathing, right? So you're basically,
Yeah.
the light's triggering your melanopsin receptors, you're,
Yep.
lowering your melatonin, sharpening your brain, picking up your energy. But that technique has been shown to really improve heart rate variability over time as well.
Yeah. I
And
love that. And if people
yeah,
have nature close by, that's pretty much what I do every morning. There's this nice brook with a waterfall. It's about a 5-minute walk. I'll spend maybe 5 minutes sort of, lapping around in the nature area. And boy, what a great way to start your day as opposed to, head down on your phone or watching the
right.
news. So yeah, a big supporter of morning walk and preferably in nature. I mean, if you can't get to nature, fine. But if you can, definitely worth it, in my opinion. And then come back to the
Agree.
breathwork thing for 1 second.
Yeah.
I'm so glad you mentioned this because I went to a breath workshop maybe about 2 weeks ago. And to be honest, I felt a little bit uncomfortable going in because, like you're painting that avatar of the sort of analytical who is a little bit, gun shy or wary about the woo woo stuff. Shout out to Aaron Alexander over at Align Podcast. He invited me. I was blown away.
Yeah.
I don't know the name of the technique that we use, but it was kind of this pseudo hyperventilation for a
Mhm.
prolonged period. I got that numbness in my extremities, which
Yeah.
apparently is a thing with this sort of breath work.
Yeah.
I started laughing. Some
Wow.
people were crying, and I left there feeling totally different, like remarkably so. And
Wow.
I'm pretty good at calling out BS, right? So, there was, I mean, the numbness in my hands and feet, the just laughing during the workshop, hearing other people crying, and then for the rest of the day, I felt very much so turned down.
Beautiful.
And I've been meaning to do a follow-up podcast on the fairly impressive amount of impact that breathwork can have on, I'm assuming, limbic, vagal, however we want to describe it, right? It turns you down if you're too turned up.
Yeah.
So yeah, I walked away from that workshop saying, my goodness, there's really something here. So just to kind of plug the importance of it with my personal experience.
Yeah. Breathing is so unbelievably critical. I mean, obviously for life, but most of us live in a state of disordered breathing where we're not paying attention to our breathing, where we're mouth breathing, we're not breathing through our nose, so critical. We're not doing deep enough breathing, and, super shallow, quick breathing, where we're getting imbalanced with regards to our CO2 and oxygen levels. And I'm sure I think you probably read it, but the book Breath by James Nestor,
Yeah, he's
just,
actually
you
been
had
on
him
the
on your
podcast.
podcast, actually. Yeah, that's
Great
great.
book. Yeah.
Yeah. Yeah. Really amazing. Super recommended. And with, some quick interventions, we can really dial back a lot of, I think that's just super foundational intervention for all of our patients, right? Just,
Yeah.
you got to nail the diet, you got to nail the sleep, you got to nail the movement, you got to nail the breathing, you got to nail the brain. All those areas are super critical for the starting place.
Maybe shifting gears for just a moment to cancer. One of the things that shot through my mind as you were mentioning this is the cancer, and it's probably hard to parse this, but outside of not sleeping well, not eating well, high levels of stress, these are all big, cancer drivers, or I should say cancer drivers to some extent. I don't want to over label. But is there something to do with toxins? Are these, the gun range? I mean, firefighters, I'm assuming, definitely are getting all sorts of intoxicants in the fumes. What there should people know about?
Yeah, so the cancer risk is particularly important for the firefighters. The National Institute for Occupational Safety and Health had a couple of really large studies, and they showed that firefighters faced a 9% increase in cancer diagnosis and a 14% increase in cancer-related deaths compared to the general population. Wow. And that cancer has caused probably at least 61, if not up to 70% of deaths for firefighters over, basically like a 15 to 19 year period of time that they studied. And you're right, it's multifactorial. I think it is in part, in significant part, related to the toxin exposure. They're basically going in, breathing, getting exposed to burning buildings, and the buildings and the fires that are happening now are just so much more toxic than they were ever in the past. If you think about like what is inside of a house now, sure. There's all this plastic, there's all these batteries, there are flame retardants in the furniture, in the clothing. Yeah. Ironically, not ironically, but firefighters who I've talked to are against flame retardants in furniture. They say it doesn't really do much
that is
to
ironic,
help. Yeah, they say it doesn't really do much to help when a legit fire happens, and the toxins that they're exposed to as a result are just incredibly incredibly bad for their bodies. But for for firefighters, the cancers that are the most common are respiratory, so lung and mesothelioma, for example. It's also GI, so mucous membranes, oral cavity, esophageal, large intestine, and also kidney. So, excretion through the bladder, through the kidney, through the ureters, et cetera. And so there is certainly that part of toxin exposure. But, if you factor in the sleep issue and the shift work, the WHO has classified shift work as an IARC-2A carcinogen, so probably carcinogenic to humans, right? And that was actually, we're expecting that to get sort of scaled up and maybe even dropping the word probably, because it's just, the evidence is pretty clear from so many different factors, right? On the immune system, on the inflammatory systems, on the detox systems, nervous system, et cetera, that sleep disruption, shift work, circadian rhythm disruption is really, really damaging and again, pro-carcinogenic. Now, of course, there's also the metabolic issue. There's the inflammation from that, and there's the obesity, but what can we do about this, right? So we can't avoid people working these shifts because that's just the nature of the job, right? They're out there protecting us while we're all sleeping.
Sorry to interrupt, but that does beg a question. Is there any data to inform people should try to have a certain amount of time off of shift work, and if you hit a certain threshold, it has a protective effect? Or what if people could modify some things? Is there something for them to steer toward? One of my best childhood friends is a police officer, and he's always talking about, well, if I take this different role, I go to the bottom of the ladder, which means I have the worst schedule. But after 6 months to a year, I have more control over my schedule. So it seems that there's some sort of oscillation and control over the sleep. With that backdrop in mind, is there something people should be like trying to steer toward in terms of a minimal balance of normal versus shift work?
Yeah, I mean, it's quite variable. So it's interesting. It's quite variable across departments as to what they're doing. Some will have, either 24 on and then off, or some will have 48 on and then a number of days off. Some in maybe less busy places will have even a 72 or sometimes 96 on. Some of that goes out the window, however, because these departments are really understaffed. And so they're doing a lot of overtime, and they get basically, it's not uncommon for them to be post shift and about to go home and be like, oh, sorry, actually, we need you to stay for longer. And that also stacks onto the trauma and the stress and the PTSD side when you have that expectation. One of the things that we worked on with them, and this was actually the feedback we got, was it was one of the most helpful interventions, was kind of like, so your point is good about what's that shift structure look like? And there are groups who are working on that, but it's a pretty slow
Probably
process.
Hard to answer.
Yeah, because again, the understaffing is really difficult, and so they just don't have a lot of flexibility. It's becoming increasingly difficult to hire for these positions as well, especially on the police side, which is really difficult. Puts the officers in such a higher stress state. But one thing that we did was we looked at, sort of thinking about what are all the things that you and I might tell a patient with regards to sleep hygiene, right? So we talked about the morning light exposure, getting outside, but having your last meal not too late, not drinking a bunch of water, decreased exposure to artificial light, not doing anything stressful, trying to get a wind down, trying to get in bed at a regular time each night, et cetera. You sort of go through the list of different interventions. Bedroom is for sleep and sex only, and dark and cool and all these things. But we kind of looked at like, what does it look like for them when they are post-call? And it gave them sort of a fork in the road of like, let's say you had a really busy shift and you didn't get much sleep at all, and you're basically going to go home and sleep. And so we gave them this whole list of things to do, which is basically, if you need a short nap before you go home, get that. Put on your blue blocking glasses when you're driving home, so trying to suppress natural light exposure. Sure. Safely get home. If you need a small meal, make it small, hydrate yourself, and then go to sleep. And sleep, for as long as you need to, as long as you can. Right. When you wake up, you basically, think about, this is a reset day. I'm not going to push myself. I'm not going to do anything stressful. I'm not going to drink any alcohol. I'm not going to eat any sugar. You're going to basically do all the things that you can do to lower the load on your organism overall, and right. Get to bed at a decent time. And then the next day, or the day 2 days later, are maybe quote normal days where you have a little bit more fun, a little more flexibility. And then your pre-call day is similar. You go into this sort of more intensive, aggressive reset mode where you're prepping actively for this shift, right? You avoid the sugar, you don't over exercise, you maybe do a little bit more mindfulness and stress management, exercise, sure. et cetera. And the feedback that we got from that was super interesting, because they just said that was really, really helpful, right? Gave them some really concrete steps to do. It helped them get adequate rest, helped them understand that, while they're feeling a bit stuck in terms of I have to work these shifts, they actually have some agency now and some, control. They can right. take charge of it a little bit. And I think that piece was really, really valuable for us as well, for them.
Awesome. Yeah. So just the foundational aspects, nothing, super fancy.
Nothing super fancy, but structuring it in a certain way. Also doing you get home and we have them do a 10 or 15 minute heart math biofeedback session or a breathwork session. Again, you and I know this, but the more times you take that activated nervous system and you bring it back down towards a more reset state, the more it knows that space, and the quicker it can get there, and the more robustly it can stay there. Right. So, and then we were able to prove that out, with them, with the data. We were able to show them as an outcome of the comprehensive program, shorter sleep latency. So they fall asleep quicker, more deep sleep, less awakenings at night, et cetera. And so that combined, intervention, sort of telling them what to do, but then proving it out with the data and pushing the data back to them to show them, really, it was pretty inspiring, and it gave us a lot of ideas around how to build our own patient programs as well.
Yeah, well, it's good you said the word patient, because one of the things I wanted to remark on is I'm sure a lot of this wisdom and protocol, or however you want to describe it, comes from what you've learned at the California, Center for Functional Medicine and your patient work there. So, it begs the question. I'm kind of curious to maybe compare our clinical notes, so to speak. What are some of the more prevalent things that you guys are seeing in your population right now?
Yeah, so we deal with a lot of pretty complex folks. We take all comers. So we have a comprehensive functional medicine approach, care team approach, with a really incredible team. I feel really blessed to work with all the folks that we work with. We see a lot of autoimmune. We see a lot of chronic gut issues, inflammatory, IBS, SIBO, just like you. And we see a lot of chronic infections, tick-borne infections, Lyme disease, co-infections, et cetera. A lot of chronic viral infections. Long COVID is obviously a huge player now that's completely redefining the chronic illness landscape. But what we see, and so we see also, other buckets which I think are incredibly prevalent, are mast cell activation syndrome, from a variety of different triggers. All those things we just listed, obviously can hyperactivate the immune system, hyperactivate the mast cells, and then you're left with these sort of overlapping conditions that look a lot like each other, right? And so you really have to work hard to tease them apart. Mold exposure is a huge one that can really intensively affect people. It can look like Lyme disease, it can look like mast cell activation, it can look like autoimmune, et cetera. So those, I would say, are some of the top buckets. Brain retraining, neuroplasticity, breath work, all those pieces are sort of like a required, piece in our opinion. Those are the things that we just always are encouraging people to do, again, because these are things they can do at home. And these are things which can calm down this confusion, this hyperreactivity, this inflammatory predisposition in the body. So.
Are there any tools there? We've been using Gupta quite a bit. We used to use DNRS, and still a fan of DNRS. I just think it was a little easier for people to use Gupta. We've also been referring some people to this cognitive behavioral therapy app called Zemedy.
Mm,
And they published, we're pretty fervently monitoring what's being published in PubMed. And so this study flagged for us. They published one clinical trial. They were able to document reductions in food reactivity, reductions in fear around food,
wow.
and a few sort of general quality of life measures improved. If anyone out there tries Zemedy, just one note I would make: they use this language, living with IBS, which I want to thank one of our patients for pointing this out to me. I don't love that language. I think and I know you know this, obviously, Sunjya, but if we have the right tools, we can vastly decrease food reactivity and
Yeah.
IBS symptoms. But from the psychological standpoint, I think a lot of what they're doing with the cognitive behavioral therapy is something that could help a lot of people. And for those for whom Gupta or a full limbic retraining program was a little bit more than we needed, the app, cheaper to use, easy entry point, what was kind of a nice tool just to throw out a few things on my side. But yeah, curious,
Yeah,
what
that's
you
great.
guys
I have not
think.
seen that app, so I definitely will look at it. That sounds fascinating. Similarly for us, DNRS was sort of like the best known, most referred to program in the beginning, and I think it's had some amazing outcomes for folks. And
Sure.
but I do feel like a lot of folks are moving away from it a little bit. I think in part because is especially when you're looking at the DVDs or the online recordings, it's just not super well done, and people just feel like it's very redundant and kind of difficult
Yeah.
to really engage with. But then, of course, there is the aspect of, they really want you to do an hour a day, which is difficult for some people. We like that, but we don't require it. If people can just get 15 to
Same.
20, 30 minutes, that still has benefit. I do really like the fact that the DNRS has the coaching support. So you can kind of transition from, the evergreen / view on your own to more of a support side. But we use Gupta, we use Alex Howard. There's another woman called Shoba, Empowerment from Within, that we've used. But really just hypercritical. We're super big fans of this work and what it can do to just calm down some of those things that you can't get to with a pill or an antibiotic
Yeah.
or some kind of a herbal tincture, right? So
Right.
it's a really helpful aspect.
Yeah, and I really do think there's something here. I've been doing some experimentation, and to fully bring us far afield here, but I've been doing some experimentation with both ketamine and psilocybin, just given
Yeah.
all the research that's been published. And I have to say, with the psilocybin, I've noticed an ability to really let go of this pervasive sort of workaholic tendency that I think over the
Mm,
past 3 to 5 years has really crept up. And sometimes it's hard to delineate as an entrepreneur. Are things more difficult and therefore I have to work harder? Or am I just taking all these things more seriously
right.
and working harder out of habituation? But
Right.
one of the things that I look to is how much time am I spending playing any sort of music?
Yeah.
And way back when in college, it was an hour a day. And over the past 3 years, it's been pretty much nilch. And just recently, I did another therapeutic round in psilocybin. This is actually 2 days ago,
Wow.
and yesterday I played music for an hour. I had
Wow.
no intention
Beautiful.
to do it. I had no expectation to do it. But I'm thinking that my own brain has just gotten far too facilitated in the work, get
Yes.
stuff done, lead the
Yes.
organization. And that's good to an extent, right? I think it's forged a lot of focus and responsibility, the ability to say no to certain things, to delegate. But along with that, there's some strings attached, which is all those other things that just, well, I can't play piano right now. This is too important. And it's amazing to me how
Yeah.
yesterday nothing situationally changed, but somehow there was an hour in the day to
Yeah.
play both guitar and piano. So not to
Wow.
be
That's
overly
awesome.
personal with the sharing, but
No, I
that
love it.
really struck me. Yeah.
So those are your instruments, guitar and piano?
Yeah.
Awesome. I
I
love
do
it.
my best,
I
right?
play drums.
Neither very well. You play the
Yeah.
drums?
Cool. Yeah. I'm a drummer.
Awesome.
Yeah. So I agree. And
Yeah.
I agree with you. I have not been playing a lot. And it is like, it takes me like, if I sit down and play, 5 minutes in, I feel that nervous system reset. I feel that sort of in the zone meditation, relaxation. And so it's just so incredibly good for us to do that.
Right.
And, the focus and the sort of being involved with something that's bigger than us, than the sound of it. And, I'll put on headphones and play along to songs. And so I feel like I'm in a band, which I'm also in a band, which is fun, but you just get
Awesome.
that feeling of engagement and play, right? So play is
Right.
so incredibly important. And I think I know for a fact on my side, I'm not getting enough play.
Right.
And so that is one of my goals over the next, over the rest of my life, really, is to find that balance, right?
Yeah.
Because that's what I think pulls us back from burnout, from just kind of like losing the mojo, losing why we're doing this, losing the motivation and the vision, and we have to have that balance. So I'd love to get together with you and play music sometime. That'd be really fun.
That'd be great. Yeah, as you're saying this, it's reminding me of maybe a parallel that you can get to that burnout or that over facilitation of certain pathways with your entrepreneurial or clinical pursuits, or perhaps if you're a patient trying to improve their health, you can also do too much in that realm.
Completely. Yeah.
So just, bear that in mind, people, that you could be a hard charging sort of CEO or whatever type, or you could be someone who's really working to improve their health, but there is such a thing as spending too much time in either one of these channels.
Yeah, it's because you're too. And I love listening to Tara Brach. I don't know if you've listened to her podcast, her lectures, but she's a beautiful, meditation Buddhist teacher. She just talks a lot about that. That we're in this trance a lot of the time of control, like that we think we have to, figure everything out and fix it all and make it all perfect. And, and so it's a very, it's a tight state. It's just kind of like grit and
good way of describing
lockdown.
it. Yeah. Yep.
Not
and very so, free.
Yeah. Opening up, having what she calls radical acceptance, and just realizing that every opportunity there's something to learn from it. And, remembering your breath practice, remembering your mindfulness practice and movement, and, just loosening up and letting kind of life unfold as it needs to at times can also be really, really important.
Yeah. Love it. And we also know, just to come back to a less invasive, easier to procure therapeutic, if you will, time in nature. We've talked in the podcast before. There's some really elegant pre-post functional MRI studies that show a notable decrease in amygdala activation after some time in nature.
Absolutely. Yeah. Japanese call it Shinrin-yoku, forest bathing.
The forest bathing.
Finnish have a good term for it. Yeah, absolutely. Getting out there, being with people you love, or on your own if that feels appropriate, and just slowing down and just tuning into what's around you, right? Having a wider sense of awareness, and that we're not the only thing that matters. It can be super helpful.
Yeah, totally. And just one thing I'll tie on here is knowing and envisioning some of the people we work with in the clinic who have a lot of reactivity, whether it be food, supplement, or environmental. Remember that degree of limbic system activity correlates with how reactive your monocytes are and how reactive your immune system is. So, absolutely. If you're trying to help some of those things, then there might be a different lever, as you said earlier, from the brain down to the gut that you can access with a pill. So, just to really try to beat the dead horse here as much as possible.
Yeah, no, it's exactly right. It's really tough. I mean, it's super difficult, thorny problem for folks, right? So if you think of the severe ME/CFS or the severe long COVID or severe long Lyme folks, they can really get locked into this very tight, very triggered physiological state that can be, frankly, terrifying, right? And then they're not getting met by their providers, and they're not getting met by everyone around them who thinks, hey, you look fine, what's wrong with you, et cetera. So I don't want to discount that at all, right? That's incredibly difficult, incredibly scary. But all the things that we're talking about, all these levers, I really do feel like have a place. But they also need the right care, right? They need the right mast cell support. They need the right support for their autonomic nervous system, which is on fire, But these are all just levers that need to be put together. They need the right support for persistent infections or for microclots in the case of long COVID, et cetera. But these are all pieces that need to be put together into a comprehensive care package. And for those of you out there who are listening to this, I hope it doesn't sound too overwhelming. But I think that's really where, clinics like Dr. Ruscio's, like Mike's, like ours, like a really good functional medicine clinic who deals with these cases, that's where you can get this help and support that you need.
Yeah.
And
And
that's our
that's so
vision.
key. Yeah, because a lot of times people think they have to do all these things and they don't understand that, well, of the 7 potential options, it's really
Yeah.
these 3 that will
Yeah.
probably move the needle. And we're going
Where
to
do you
start with
start?
1, and then
Yeah.
get a little bit of traction, maybe a little bit less reactivity, a little more happiness, then layer on 2, and 2 may not have been tolerable to you a month ago, but now that we've gotten a little bit of traction, it opens up more therapeutic opportunities for us. But it's just that guidance, the knowledge of how to use the tools. One of the analogies I used in Healthy Gut, Healthy You was, if your car broke and you could go into a mechanic's machine shop, just because you had the tools doesn't mean you'd know how to kind of use them appropriately. And maybe that's a good chance just to, I know you got patients here coming up, so I want to make sure we don't keep it too long. But if people wanted to work with the California Center for Functional Medicine, where do they go? How do they connect with you guys?
Yeah, it's a pleasure to be here with you, and just appreciate the chance to connect with you and with your audience. So yeah, the California Center for Functional Medicine, we are based in California. We do see patients across the U.S. From a telemedicine point of view. We're actively pursuing licensure in a number of additional states as we need to. We have providers also in Colorado, and a number of different states. So, and we're actively growing. So actually, one of the things we talked about in the beginning was, if you're a clinician out there and physician, reach out to us. We're looking to hire some more folks. But our website is ccfmed.com, and you can go on there. You can learn about our patient offerings, and we also have a new service that we launched called the Functional Medicine Checkup, which is a 2-visit $500 offering, which is really an opportunity for folks to get some basic labs, or actually pretty deep dive, almost 75 or 80 different lab markers, and then get a visit with us to say, okay, here's what we're seeing, here's what some of the initial recommendations and plan of supplements, et cetera, dietary, and as a sort of like an entree or a tasting menu to get some care. We're really interested in the fact and trying to solve for the fact that this care is complex and can be expensive, and we're trying to figure out how do we get more people to be able to access it. Website. We're also on social on all the different channels, so you can find us there. We'd be happy to help in any way.
Awesome. Well, Sunjya, it's been great catching up. It's been too long, but love what you're doing. Keep up the good work.
Thank you, Mike. It's great to be here. It's a pleasure, and I look forward to getting together and jamming sometime soon.